The United Nations Office on Drugs and Crime is hosting a 2-day workshop in Belize City to look at how to improve access to controlled medicines while preventing abuse and misuse.
There is very special medicines because they are sometimes controlled drugs. And in this occasion, we are in the country to have a workshop in that we develop the capacity building of the health professionals and also other institutions, for example, universities, that wants to know more about this kind of controlled substance and how they can use it for the benefit of the patients. There are many patients that have problems with pain, and we as health professionals need to know how to take care of this situation in the patients.
So this event brings together personnel from a number of agencies who may come in contact with pain medication, from customs to police officers to pharmacists. The goal is to get a regional perspective on how to deal with these controlled drugs and ensure that Belize has the right controls, but also give access to those with prescription.
We want to get the regional response of how they deal with controlled drug abuse, especially in patients that are on palliative care medication, which is mainly pain medication, and those are narcotics and psychotropics, and those are prescription-only medication, so it has to be prescribed by a doctor, and so we want to ensure access as well as ensuring that it doesn't get into the illicit trade and we have abuse in our population.
The misuse and abuse of controlled drugs have seen a resurgence in the United States. While there are no statistics available to paint a bigger picture of this problem in Belize, Samira Gongora says that there are persons who do misuse and abuse pain medication. Addicts are often nervous and agitated. They would do anything to get access because they can't go without the drugs.
When it's not only for the treatment of the pain, but they have to have it all the time and it's abused, and even though the pain is being managed, they still have to get it. Or if it's a person that doesn't even have a condition that requires the narcotics and the psychotropics, but getting the medication and getting that feeling of euphoria from it, and then we know that they're being abused.
There are a number of measures and legislation in place to prevent the misuse and abuse of controlled drugs. The Misuse of Drug Act is one piece of legislation that guides the sale of these controlled drugs by way of a narcotics prescription. The importation of controlled drugs also goes for approval through the Ministry of Health's pharmacy unit. Gongora says that this partnership with the United Nations Office on Drugs and Crime will help to strengthen more controls.
We hope to get technical support from the UNODC in terms of getting legislation off the ground, especially with the CDB, the cannabinoid derivatives that we're seeing now. We hope to get legislation so that we can manage the importation of those types of drugs, because sometimes the controlled drug is being altered somehow to get it in. So we want to ensure that we can close all those doors in terms of getting them in country.
Reporting for News 5, I'm Andrea Polanco.